My involvement in chronic fatigue syndrome started in 1989, 19 years ago now, when as an osteopath, specialising more in sports injuries, I had a patient that came in who previously was a cyclist. And he told me he's got postural problems and he had back problems, that's why he came to me. But he also mentioned that for 7 years he had chronic fatigue syndrome, ME. And in those days I thought, well, there's nothing much I can do for that. In the 1980s we all, thought it was just psychosomatic, and tender loving care, smile at the patient and it might help them. But I have no concept that I could help this person from his chronic fatigue, but I could definitely help his postural mechanics. And I started treating him, and lo and behold, after a few months, he started significantly improving, and eventually he, within the few months I treated him, he said his symptoms have disappeared. I've cured him. I said, no, nonsense. How can I help you? So he said, no, you have, and he was the one that started me all those years ago in my search for why I managed to help this patient and what was going on. So we start with the thoracic spine, because he had thoracic spinal problems, and in my paper of 1993 in the British Osteopathic Journal I looked at the common findings in patients with associated symptoms. I had quite a few patients with these ME type symptoms, and I wasn't somebody to diagnose ME, but I noticed that they had all the same problems. Their thoracic spine was visibly not posturally the way it should be. It should be curved in the middle and what we call slightly kyphosis, and they were often flattening and distortion, as you'll see. This is a healthy spine, and you can see here how it curves out and then inwards there, what we call a lordosis, and a kyphosis and lordosis, which goes inwards. And we see an ME patient where there's definitely a flattening, and this picture was taken in 1989, 1990, this patient, many years ago. And equally we had patients who had very rigid spines, especially the elderly ones, so they had definite visible problems in their thoracic spine. Very, very clear flattening and then outside. And we saw problems affecting not just the back of their postural mechanics, but also the very front. And you can see here how her sternum is completely concave there, putting terrible pressure on the mechanics of a thorax. And what we saw in many, many cases was what we call osteochondrosis or Sherman's, where the flattened area and this area of the spine should go in and it goes out quite often. And this is again and again and again. In the hundreds of patients, over 1,000 patients I've seen since 1989, they all have major problems that you can see in the spine. They might not have pain. Not all of them have pain associated with it, but most of them do. And in fact, most of them have a lot of tenderness in the mid-thoracic area. And I thought, well, what's going on? How can this be? And nobody actually had looked at the mechanical ME CFS from a biomechanical perspective. And I suggested that at that time, the centre of the sympathetic nervous system, which you've heard about this morning, part of the autonomic nervous system,